Okay, let's continue. So a quick recap. What was I saying? That if anyone is referring to solely tonsils, it means they're referring to palatine tonsil. So this is an image of the palatine tonsil. It's a Latin word which means swelling, right? I told you about the four sorts of tonsils which are there. This is a palatine tonsil. Posterior and superior, you'll find the pharyngeal, nasopharyngeal or pharyngeal tonsil. Once swollen, it's also known as adenoids. This is the tubal tonsil superiorly and laterally, and inferiorly you'll see the lingual tonsil, right? So these are the four tonsils, and they basically form a Valder's ring here. So you'll see that there's one pharyngeal tonsil, there are two tubal tonsils, there are two palatine tonsils, and there is a lingual tonsil. So total six. These are masses of lymphoid tissue. So basically, they're part of the immune system. They help to trap any sort of germs that are entering your, GIT system through your nose or mouth, right? Now, talking about the palatine tonsil, I told you it has two surfaces, two borders, and two poles. Two surfaces. So it has an anterior surface and a medial surface and a lateral surface. And borders, interior border and a posterior border. Interior border, posterior border. Anterior border is firmly attached to the side of the tongue with the help of the suspensory ligament of tonsil. This is the name. This attaches the capsule of the tonsil, the hemicapsule of the tonsil, to the side of the tongue. It ensures that the tonsil is held in place, especially during swallowing, right? Now, this is what we've already talked about, the interior border. Now, posteriorly, what happens is that posteriorly the tonsil is loosely attached to the posterior wall of the pharynx, which basically comprises of constrictor muscles and styloglossus, right? So it's loosely attached. So what does the function of firmly attaching it? The suspensory ligament, and it's in the interior border. When you talk about the surfaces, the medial surface is lined by stratified squamous epithelium. Stratified squamous, don't forget that. There are 12 to 15 crypts, and the crypt that's deepest or largest, that's called intratonsillar cleft. Don't forget the name. Just keep in your mind this word intratonsillar cleft, right? And then if you talk about, this is the medial surface. If you talk about the lateral surface, it is covered in a capsule, hemicapsule of tonsil. This hemicapsule is derived from fascia. Which fascia? Pharyngobasilar fascia, right? Now, the tonsillar artery. What's the function of the tonsillar artery here? Tonsillar artery is basically a branch of the facial artery. Facial artery is the branch of the external carotid artery. Now, external carotid artery branch facial artery. Facial artery has another branch, which is the tonsillar artery. Now, this tonsillar artery, it pierces the superior constrictor muscle, and it enters the, after piercing the superior constrictor muscle, where's the superior constrictor muscle? This one right here. After piercing that, it enters the tonsil, right? And what about the palatine vein? Palatine vein or external palatine vein or paratonsil vein. What are the three names of this vein? Palatine vein or external palatine vein. So you just have to add external, or paratonsillar. Don't forget this. Paratonsillar vein. These are the three names of the same vein. Paratonsillar vein, palatine vein, external palatine vein, or paratonsil vein. Right? Now, this vein basically, what does it do? It descends from the palate into the loose areolar tissue on the lateral surface of the capsule. So, first it lies in the palate. From there, it descends on the lateral surface of the capsule, and from there it crosses the tonsil before piercing the wall of the pharynx. So it crosses the tonsil and then it pierces the wall of the pharynx. So first it lies in the palate, then it comes and lies next to the capsule, then it crosses the tonsil and pierces the wall of the pharynx. So this is the palatine vein or external palatine vein, or paratonsillar vein, right? Paratonsillar vein, don't forget this name. And this was intratonsillar cleft. Now, and we also spoke about the tonsillar artery, which is a branch of the facial artery. Tonsillar artery pierces the superior constrictor muscle and provides the arterial blood supply to the palatine tonsil. Now, how about the bed of the tonsil? Before the bed of the tonsil, a very important clinical um, uh, significance of this vein that we just discussed, the paratonsillar vein, is that during the tonsillectomy is basically the tonsil removal surgery, there are high chances. that this vein can be injured. So the doctor or the surgeon, they need to be really vigilant that they shouldn't injure this nerve, the peritonsillar nerve, or you can call it the palatine vein or external palatine vein. Sorry, peritonsillar vein. Did I just say nerve? Okay, now moving on. Now, this tonsil, as I've told you, medially it's just free, it's just there, right? It's just enjoying the life. But laterally it lies on a bed, so it's sleeping very peacefully. So, what forms this bed of the tonsil? So, how is it formed? Let's just discuss from within outwards. First of all, there is uh, this is the peritonsillar vein, right? That you know. So first there's this pharyngobasilar fascia, then there's superior constrictor muscle and palatopharyngeus muscle. Then you have the buccopharyngeal fascia, very important, don't forget. So you have um, pharyngobasilar fascia, superior constrictor muscle, buccopharyngeal fascia. Then you have the lower part of the styloglossus muscle. So styloglossus muscle is also there, and there's the glossopharyngeal nerve. Glossopharyngeal nerve is this in yellow. Right, and this submandibular gland also. I found this image better, so let's just discuss in regards to this. So this is your tonsil, that's your peritonsillar vein, this is your pharyngobasilar fascia, this is your superior constrictor muscle, this is your buccopharyngeal fascia. Then I told you there's your inferior part of the styloglossus muscle, there's glossopharyngeal nerve. So look at the positioning of your glossopharyngeal nerve and the styloglossus muscle. It's so like protected. Styloglossus muscle and glossopharyngeal nerve. This is the facial artery. Now facial artery here you can see it's two branches. One is the tonsillar artery, the other is a glandular branch. The tonsillar branch it provides to the tonsil, and the glandular branch it provides blood to your submandibular salivary gland. Don't forget this image. It's a super important image. If you know this, you'll know everything. The borders, the surfaces, the poles. Did I talk about poles? Superiorly, you have the palate and inferiorly, you have the tongue. So basically, everything is covered if you memorize this diagram. Still more laterally, their facial artery. So this is the bed, right? But still more laterally, you'll see the facial artery with its tonsillar and ascending palatine branches. It also has ascending palatine branches. The internal carotid artery is 2.5 centimeter posterolateral to the tonsil. And this is a branch of external carotid artery. But there's also internal carotid artery, but that is 2.5 centimeter posterolateral. So this is the lateral surface, right? This is the medial surface. So posterolateral, posteriorly and laterally, somewhere. Now, next, they're saying that the interior border is related to the palatoglossal arch that we know, posterior border is related to the palatopharyngeal arch that we know, upper pole is related to the soft palate, lower pole is related to the tongue. Now, they're talking about plica triangularis. It's a triangular vestigial fold of mucosa membrane covering the inferior part of the tonsil. Now, the inferior part of the tonsil, there you'll see a plica triangularis, which is a triangular vestigial fold of mucous membrane. And then there's also plica semilunaris, which is similar semilunar fold that may cross the upper part of the tonsillar sinus. So there are basically two folds of the mucosa membrane, plica triangularis and semilunaris. Intratonsillar cleft is the largest cleft of the tonsil. It is present in its upper part. Yes, it's present in the upper part, never on the lower part. It is sometimes wrongly named the supratonsillar fossa. Nope, it's not the supratonsillar fossa. The mouth of the cleft is semilunar in shape and parallel to the dorsum of the tongue. It represents the internal opening of the second pharyngeal pouch. The peritonsillar abscess or quinsy often begins in this cleft. So, what's the significance of this cleft? That often quinsy or peritonsillar abscess. It often begins here. So quinsy or peritonsillar abscess. What? Quinsy or peritonsillar abscess. So repeat it a few times. It often, develops. It often develops um, in this intratonsillar cleft. Now, what's the arterial supply of the blood of the tonsil? Now, first thing is the tonsillar artery of the facial tonsillar branch of the facial artery, right? That's the main source. What are the additional sources? I told you this also has ascending palatine branches, right? So those ascending palatine branches also they are additional blood supply or the source of blood supply to your tonsil. Other than that, you have dorsal lingual branches of the lingual artery. You have ascending pharyngeal branch of the external carotid artery. This external carotid artery, right? It also has ascending pharyngeal branches. So if there's external carotid artery, it has a facial artery, but it also has an external. This also has an ascending pharyngeal artery branch. So that ascending pharyngeal branch also provides blood to your tonsil, right? And then you have greater palatine branch of the maxillary artery. So in total, I've named almost five things so far. Main supply is the tonsillar branch of the facial artery. Then you have the ascending palatine branch of the facial artery. Then you have the dorsal lingual branch of the lingual artery. Then you had the branch of maxillary artery, which is the greater palatine branch of the maxillary artery. We're done with four. And the final, I told you that there is internal carotid artery, sorry, external carotid artery. External carotid artery has a branch which is ascending pharyngeal branch. So that's the fifth. That's the blood supply. Venous drainage, one or more veins leave the lower part of the dorsal deep surface of tonsil, pierce the superior constrictor, and join the palatine, pharyngeal, or facial veins. So I suppose this is one of the veins, but yeah, these veins they leave the tonsil, the lower part of the deep surface of tonsil. From here, they pierce the superior constrictor muscle, and then they join the palatine. This is the palatine vein, the pharyngeal vein, and the facial vein. So from the lower part of the deep surface of the tonsil, they leave and they drain into the palatine vein. This is also known as external palatine vein or paratonsillar vein, or the facial vein or the pharyngeal vein. So these are the three veins. Lymphatic drainage. Lymphatics pass to jugulodigastric node. Which node? Such a fancy name. Jugulodigastric node. So that's a mouthful. Jugulodigastric node. And there are no afferent lymphatics to the tonsil. What about nerve supply? Glossopharyngeal. See, this is the glossopharyngeal nerve or lesser palatine nerve. So this is the nerve supply. That's it. Now let's quickly discuss the anatomy, the clinical anatomy. The tonsils are large in children. They retrogress after puberty. So in children, you'll often see the tonsils are pretty large, but they retrogress after puberty. In the end, finally, I'll just discuss the blood supply once again. Before that, I will discuss the clinical anatomy. So I told you in children, often tonsils are there, but they retrogress after puberty, especially the nasopharyngeal tonsil. It completely vanishes after the age of 20. The tonsils are frequently sites of infection, especially in children. Infection may spread to the surrounding tissue, forming a peritonsillar abscess. So there are high chances that the infection spread to surrounding tissues, especially the intratonsillar cleft, and it forms peritonsillar abscess, also known as quinsy. Remember? Now, enlarged and infected tonsils often require surgical removal. The operation is called tonsillectomy. A knowledge of relationship of tonsils is of importance to surgeon, and there are high chances that they can damage the peritonsillar vein if not done vigilantly. Tonsillectomy is usually done by guillotine method. Hemorrhage after tonsillectomy is checked by removal of clot from the raw tonsillar bed. This is to be compared with the method for checking postpartum hemorrhage from the uterus. So what is this method called? Guillotine method. There are only two organs in the body where bleeding is checked by removal of clots. In other parts of the body, clot formation is encouraged. So there are only two parts of the body where you have to remove a clot from that organ after surgery to ensure that there's no hemorrhage. One is the tonsil and the other is the uterus. In the uterus, it's done usually after the delivery of the baby. So after, this is basically a postpartum procedure. In tonsil, after the tonsillectomy is done, so you remove a clot and it's sent to the lab to be investigated using this method called guillotine method. Now tonsillitis may cause deferred pain in the ear as glossopharyngeal nerve supplies both these areas. Suppuration in the peritonsillar area is called quinsy. A peritonsillar abscess is drained by making an incision in the most prominent point of the abscess. Tonsils are often sites of septic focus. Such a focus can lead to serious disease like pulmonary tuberculosis, meningitis, etc., and is often cause of general ill health. Now, yes, that's pretty much it. Let's quickly revise the blood supply. So I told you, first of all, facial artery holds its significance. Let me quickly revise the facial artery. Facial artery has two sets of branches. One is a cervical branch, which basically neck branches, and facial branches, face branches, right? So the cervical branches and the facial branches, these are the facial branches. You have angular artery, lateral nasal artery, superior labial, inferior labial. So there's external carotid artery, right? It has a few branches, and remember I told you it winds around and comes in front of the mandible, and it is very highly tortuous. See here also you can see how tortuous it is. So facially it has four branches: angular artery, lateral nasal, superior labial, inferior labial. And its cervical branches are ascending palatine artery. Remember, it was an additional source of blood supply. Then it has tonsillar branch, the main blood supply of the tonsil, glandular branch, which gives blood to the submandibular gland, and submental artery, larger cervical branch. Now this is your tonsil. It's see so it's completely protected. Artery supplying the tonsil. So this is your external carotid. This is the common carotid artery. This is external carotid artery. This is the internal carotid artery. Sorry, let me recap. This is the common carotid artery. This is the internal carotid artery. This is the external carotid artery. External carotid artery has a facial artery, and external carotid artery has a facial artery. It also gives an ascending pharyngeal branch. The ascending pharyngeal branch is also a blood supply, right? So first of all, the facial artery has a tonsillar artery. That is one of the blood supply. Another thing is it has a palatine, ascending palatine artery. That's another blood supply. So these both are the branches of the facial artery, right? Then you have the dorsal lingual arteries, which are basically of the lingual artery, branches of lingual artery. So third, we are done. Fourth is the maxillary artery. It has a branch called descending palatine or greater palatine branch. So that greater palatine branch is basically blood supply of tonsil. And fourthly, we had that there's another branch of external carotid artery, which is ascending pharyngeal artery. So that is another blood supply. So there are total five blood supplies. So yeah, that's pretty much it.